there, it's Dr. Daniel Hockenberry over at Ried Physical Therapy. Today I'm going to be talking a little bit about some difficulties with the lower back. So I actually had a previous video where I talked a little bit about neck pains in your sleeping position. So often, again, one of the frequently asked questions we get is, when I wake up in the morning, I'm having more pain in my lower back. I don't quite understand why. So kind of similarly as to the neck, we also would address this probably in the upcoming visits, the very ones after the initial eval or after we learn this information. So something that's really, really important here with working on lower back pains that kind of start in the morning is the first couple of things we address is, again, their sleeping position. Sometimes the pillow that their neck is on or the way that they adjust their body at night. Are they laying on their stomach, which we usually don't recommend? Are they laying all the way rolled forward where they're putting a lot of strain on their lower back? Or do they sleep on their side and they actually don't tend to use a pillow or anything between their knees to add a little bit of support there for their lower back and hips? So those are actually a couple of areas that we tend to spend a lot of time educating on and working on. So as I had mentioned, sometimes what we can do is actually when the knees are being brought together when we sleep at night, it puts a lot of strain on our lower back because of the nature of the muscles that surround that area. As well as that, if we sleep with our knees too far up or too far extended, we can put strain depending on the patient, depending on who we're looking at. So what we often recommend is a pillow between the knees. This actually can cause a good amount of separation between the hips. Dependent on the patient, I recommend certain pillows. If the patient tends to be a stomach sleeper, I often will start them actually using some type of body pillow or a pillow in their arms to prevent them from rolling over onto their belly. The stomach sleeping actually is a really big issue with applying a lot of force through the lumbar spine, actually causing more back pains. So that's usually something we try and kind of start right out with and get that out of the way. But going back to the pillows, we actually find that is able to help increase that separation in the hips there and not apply as much force through the lower back. So again, this is one of the first things we usually try and tend to spend a lot of time working on. It's kind of a principle that we'll start with and then maintain with the patient as we're moving forward. Because as I mentioned before, in our cervical patients, our lower back patients also tend to have these problems as well. And we actually have to spend a little bit of time there also.